So when a therapist wants you to teach a patient a new exercise, you will do 4 things. You will teach, demonstrate, watch them do it, and then correct if needed. For example, if we're teaching them to do horizontal rows, I will come over here and get the patient. Jessica, we have a new exercise for you. And you will grab the equipment necessary, and it's usually best to start lighter than you think they need, just to avoid injuring them more. And so what you'll do is you'll explain to them what you'll be doing. This is called a horizontal row, and it's gonna help work some of your back and shoulder muscles to improve posture and things. And what you'll do is you'll take the bands in your hands like this, and you'll just pull them back so that your elbows are at 90 degrees. And you'll just go back and forth, nice and controlled. You'll do 3 sets of 15, and you can take breaks in between each set if you need to. So after I've taught and explained, I will give the patient the bands, and you will watch them do it. And if they're doing it wrong, then you correct them a little bit. So with this one, it's best if you bring it back so that your arms are at a 90 degree. Yeah, perfect. And you watch them do it for maybe the first rep or so, just to make sure they're doing it correctly. You make sure you mark it down on the chart as well. Always want to make sure that you tell them what the reps are, like how much they're supposed to do, and you also can tell them if it's too easy that they can move up, or if it's too hard, they can move down in resistance or weight.
When teaching a patient an exercise, you need to always explain to the patient what they should feel and possibly any common mistakes that there would be as a part of doing that exercise. Always tell them, like was mentioned, the sets and the reps that they'll be doing and when they should stop. So for example, if we don't want an exercise to be painful, which we don't, then you should tell them to stop if it is painful, or that they can decrease the weight. A good way to get patients to know what they should feel is by tapping or touching the muscle that they should be working so that they can feel tactily what is actually happening. Just because a patient has done an exercise correctly once does not mean that they will continue to do the exercise well. Patients fall into bad habits often, so make sure that even if you've taught them and you've seen them do it correctly once, that they can still do it correctly again.